Hello everyone, welcome to Docthub Talks. Today our guest is Dr. Madhuri Bhat and she is working in a healthcare IT with a background of Ayurveda graduation and master in hospital administration. So we will discuss what was her journey and how is the life career in healthcare IT for any medical graduate and healthcare graduates if they are want to pursue their career in healthcare IT? What all are different aspects they should know about it? So welcome, Dr. Madhuri. We can start. I think first let us know what is your journey and what is
Yeah,
your current role, what you do in healthcare IT kind of,
yes. Thank you, Dr. Sandip. Thank you for this opportunity. Yeah, coming to my journey, basically, I am born and brought up in a typical, rural setup and very humble background. So always good at studies.
Okay.
So always dreamt of becoming a doctor, and there were ups and downs because the ups all started with my SSLC, where I came out as a taluk topper, and then all the expectations increased, and I actually started believing in myself that I can achieve what I want to do in my life. And then soon enough, I won many. There were many successful events that happened in my life. I won scholarships. I
Yeah.
got sponsored education, government seat. Also, there
What
came a low
it was
point.
in which college? You did it Ayurveda
Government Ayurveda College, Mysore.
Mysore. Okay, okay.
Yes, Mysore is a place in Karnataka.
Yeah,
So yeah, so once I became a doctor, I mean, soon after becoming a doctor, as usual, I started with my practice because that was all I dreamt of till then. But then once I started practicing, I also started thinking what I want to do next. I mean, is it all becoming a doctor and practicing medicine is all I want to do, or do I want to do more? Do I want to explore more, learn more things about healthcare? So there were many options. There was this masters in Ayurveda
yeah,
masters, and
master.
there were like masters in public health. There
Yeah,
were masters, yeah, very other masters like yoga therapy and
yeah.
various other MScs. So meanwhile, I also learned about masters in healthcare administration, which was kind of very interesting
Okay.
course for me because I learned like what is the curriculum, and it was very wide variety of subjects.
Applicability. Yeah. Okay.
Yes, the curriculum itself is very enriching and very interesting, which we didn't come across while we were studying medicine, right?
Yeah.
So it was very interesting for me, and I just after a lot of giving it a lot of thought, I joined St. John's Medical College, which is in Bangalore, for my MHA.
Okay.
And both my graduation and masters both were under Rajiv Gandhi University of Health Science.
Yeah. So, what
So
was your thought process during MHA? I mean, about career while doing MHA, about career, what were our options you were thinking? No.
yes. So actually, I entered MHA with the thought of being a administrator, right?
Okay.
After getting all
Yeah.
the experience in the hospital sector, and my college had this 1,000-bedded big hospital. So all the department I came across, and we had this internship, and we came to know various things, how actually in big
Yeah.
hospitals it operates, right? So healthcare IT was also one department, but I didn't have a clear cut thought that I will get into one department, because there was this medical operations, there was quality, there
Yeah.
was healthcare IT,
Because
and
usually
human
MHA
resource.
students are in a mindset of going for the quality, hospital quality management kind of. These are the common
Yes,
thought process MHA graduates have,
yes.
So,
Exactly. So similar was my thought process also, because healthcare IT was, I don't know, like when I was entering, it was not that prevalent hospital for MHA.
yes,
So
yes.
hospital quality and operations were
Which
more
year
prevalent,
it
and
was?
being
You were doing
it
MHA?
was in 2018 I entered
2018,
St.
yeah.
John's Medical,
Okay.
2018, before COVID.
Yes.
So yeah, being a doctor, they always there were other doctor lecturers for us,
Okay.
they had a doctor background and they became lecturers in MHA. So they also kind of suggested medical operations,
Yes.
that route, right?
And that's
And
our soft corner somewhere, being a doctor in a hospital. If I'm doing a hospital management, then, hospital operations and medical administration is our soft corner that we used to manage coordination with doctors and patients and things like we,
yes, I mean, we can add value, and
yes,
because you are already doctor, even you can manage doctors also
yes,
going in future in hospitals, right? So also, but there was a subject also for healthcare IT.
yes,
We had a subject in our curriculum, and whenever we learned about healthcare IT, it was very fascinating because at home everybody is a IT professional. So
yes.
all my cousins, my husband, like everybody in the family are IT professionals. So for
Okay.
us being a doctor, it was really fascinating, like how IT in healthcare, right? So it was a question, it was a curiosity at that time. I think COVID made it all relevant, I can say,
Okay.
because during COVID, hospitals literally started hiring new
Yes.
management trainees.
Management and all.
So, yeah, there was more of care
Yes.
delivery.
And
Even
sudden
if you are a manager,
increase in the demand of healthcare manpower and healthcare professionals during the
exactly,
COVID and
exactly.
after COVID also.
Yeah, even hospitals also started with this remote work
Yes.
kind of
Remote work.
facility, and they stopped hiring also more people because they said we don't have other patients now, we only have COVID patients.
Yes.
So I was also at the end of my MHA, I came to know about startup companies like Practo.
Yeah.
So
Okay.
Practo's vision, like bring making healthcare easier for all the people out there, is kind of matching my vision also. So
Okay.
I became interested towards Practo, such companies. So soon after I completed my MHA, I joined Practo.
Okay.
So there it was medical operations, and it was a remote work facility also.
Okay.
So I was there for about 1 year, 1 year, three
So,
months.
yeah, what
So
exactly the job description, is in a Precto kind of a company, healthcare IT company where you are working remotely in a medical operation. So, little bit your work details so that, if someone want to pursue that career, he can get
yeah.
more idea about, that career pursue, how to and what to do in that job role.
So basically, there was a team of doctors who had experience in management courses
Okay.
as well. Like they had passed out of MHA or MBA.
Uh,
So we had formed a team of about 10, 15 doctors. Other people who were working in Practo were technical people. They
yes.
didn't have this
Yeah.
healthcare kind of experience. We used to add value to them with our knowledge on the hospital side or clinical side by their project was like conduct surgeries in various hospitals
Okay.
and tying up with various surgeons, various hospitals, laboratories, I mean diagnostic centers,
So that's
and
kind
also
of the
pharmacy.
service. That's the model of like people can approach
So their model
electrically
was
on
service.
service. Yes,
Yes,
I mean on
service.
Practom mobile app, patient app, they can book a surgery and they can book an inquiry kind of where do I surgery that, and you guide them that this particular surgery with your surgeon in particular hospital, and Practo team manage entire experience
Yes.
for the patients, right?
Yes, also
Okay.
we look after, like if this patient is eligible to, go through
Yes.
surgery. I mean, because it
Okay.
was practice service, we had to be very thorough in
Yes.
sending patients, right? We cannot send any patient, and it is a risk for the company
Yes.
as well.
Yes.
So we have
Okay.
to screen patients before, sending them for any surgeons or
Okay.
surgery. So and also handling all this chain
End
of
to end,
people,
complete
yeah,
process
end to end.
coordination. Okay.
Exactly, exactly. So that was my work there, and also I worked between departments. I mean, it is not that only with the doctors. We also worked with other technical side people,
Okay.
giving them inputs, feedbacks, how they
Okay.
can improvise. So back then, it was one of the business models that they had, and I got my learning there in medical operations. So after completing 1 year, I started looking for more. I mean,
Okay.
learning new things. Um, so meanwhile, I got this opportunity in eClinicalWorks, which is a purely healthcare IT company, which is a product-based company,
Yes.
and
So
it is a complete different,
okay,
I can
so
say,
I
different
think
domain.
viewers might not aware about healthcare IT products. So if we can
Mm.
make it simplify for them, that what exactly
Yeah,
the healthcare IT products we mean about. I mean, uh, we say, I mean, it's a hospital software or electronic health record related softwares like.
yeah.
uh,
So basically, healthcare IT,
yeah,
if I say, IT means information technology, right? So use of information technology in healthcare.
healthcare.
Simple. So how we use in healthcare, but this, if we have to use information technology in healthcare, it has to make some sense. It has to make the job easy for the people who are in healthcare,
Okay.
and it has to increase the efficiency, mainly bring in efficiency.
Yes.
So hospitals use this information technology for the management of their data or
Operations,
day-to-day
day-to-day
operations.
operations, right?
It all binds different departments of the hospital. Just sitting in one place, you can handle all your hospital's data in one place. That is about healthcare IT
Yes.
product, if I can say. So that particular binding agent we call as healthcare IT
Yeah.
product.
Yes.
So product, I can say, if I in information technology, we call it as a software.
Yeah.
So the software itself is a product.
Product.
So in hospitals, they use this hospital information system or laboratory information system
Laboratory.
in
Yeah.
lab. Then there is electronic health record, where hospital is completely paperless.
Paper.
Their complete data, the patient
Yes.
related data, everything in one platform. It can be in their local
Yeah.
database server or on cloud.
Yeah.
So yeah, this particular process, or this particular process of storing the data in one place, is happening through a product, that is a software. So that we call as a healthcare IT product.
Okay.
So eClinical Works is one such platform where they make different such products for the use of healthcare industry, maybe by doctors, maybe by quality professionals, or maybe by a laboratory, maybe by human resource
Yeah.
department. So any department for that matter. So all in one is called electronic health record, which includes even patient specific
Yes.
data. It also reduces kind of all the errors which happens while we are recording the data in paper, right? Because
Hmm.
in system we feed information very specific. It
Yes.
is not like you're writing something, it is you're
Yes.
typing. So system stores and reduces errors also. So it is supposed to enhance, or if increase the efficiency in your operations.
Okay.
Healthcare IT is such a field where you provide the hospitals or the healthcare professionals with the benefit of this particular information system.
Okay.
So I joined eClinical Works to
What's your job
learn more
role?
about.
What's your title? Job title is?
So I was a project manager. I joined as a project manager. Yeah, I continue to be a project manager. So it's about 2 years now. I will be completing 2 years soon
Okay.
in a clinical works. And after I joined healthcare IT, I actually learned what work-life balance is, because we from healthcare professional, we never had this thought of work-life
Monday
balance,
to
because it
Friday.
was always service,
Okay.
always rotational shift, work
Yes.
on Saturday, if wanted, work nights, during nights also, work anytime, on call. Like that was our way of working. but once I started working in the healthcare IT field, I actually experienced what work life balance is, and how that enriches you, and keeps you always content and satisfied, and good
And also
sleep.
you also keep on challenging new keep on learning new things. You're getting technical and other new challenges in healthcare, and new kind of things
Ex-
that we have
exactly.
not been gone through any textbook and all. You need to find solutions out of the textbook.
Exactly,
Yeah,
exactly. So we need to think like a doctor. Like if you
yeah,
want to give a software to the doctor, we need to think like a doctor, what they need. We
yes.
need to take their inputs as well as use our expertise in the field, because we are also from that background. We
Yes.
also kind of know what they actually expect from a product
And I
like
think
ours, right?
the most important crucial role is to make explain, or you make understand the technical team, no, the developer,
That is a challenge. That is
engineers,
a challenge. That
to
is a challenge
make them
because they don't
understand.
understand
Yes,
where we are coming from.
yes,
And we need not only doctors, we need to think like everybody in the hospital. Like we
yes,
need to also think like a housekeeping staff, like what
yes,
he would like to do in the software,
yes,
how he would like to perform some his
yes.
duties, or restore his data in the software. We should be thinking like a laboratory staff, like what they would want in the product.
So kind of a
So we
bridge between end users and the engineer. I mean, the developers, the
exactly.
technical team.
Yes,
Yeah.
while we learn how technical things happening, right, from a healthcare background, we have the least idea about technical
Yes,
things. So
yes.
while we learn that, we also add value by making them understand what we need, or what
Okay.
the healthcare needs
So that the end
from
users
them.
find the solutions for their day-to-day work and all. So is it
Exactly.
so as a healthcare graduate or a medical graduate, if I want to pursue in healthcare IT, do I need to mandatorily go for the hospital administration and management course, or I can should I can I go directly to healthcare IT? What exactly your suggestion to them?
Yeah, so it is not a mandatory thing to do after your graduation. When you are a medical graduate, you are already qualified for this.
Yeah.
But it depends on your determination, your interest, your passion also.
Okay.
Without doing a MHA, you can get into healthcare IT, but you need to have that vision, or have that interest, or
Hmm.
kind of you need to be a tech savvy. You need to be
Yes.
open to this, because after becoming a doctor, it kind of narrows down that you are practicing, and I only do clinical practice or teaching students. So our mind will be in that sense, and it is a teaching. I mean, it comes from 5.5 years of long medicine
Yes.
course, right? Even we are not given this thought of doing anything else apart from practicing.
Yeah.
So you will not have that communication skills, or you will not have that wide vision to even enter to this field, because we will have to attend interviews, right? So while hiring, they will at least expect you have slight knowledge of what they
Knowledge.
are doing in their
Yes.
company.
And at least a
uh,
thought process. What
yes, you
your
have to have that thought process.
because
It
we
is not
in
mandatory
medical
that you
graduation we never thought about it, and there is
yes, it's
no very
these days. Yeah, these days I can see by seeing our seniors, or there are some point of contact that we have seen someone doing other than practice these days.
okay.
But back few years back, it was very less. At
No,
least where
very
I studied,
yeah.
it was very less scope or perspective that we had about healthcare IT. So yeah, doing MHA is not mandatory, but studying MHA gives you that wide sense of what actually healthcare is.
So in your day, you're working one particular typical working day. What kind of different professional task you do in your job? So little bit some idea where
Yeah. So basically, my current shift is 11 a.m. to 8 p.m. It's a 9-hour shift every day, 5 days a week.
Okay.
So Monday to Friday, I start my day with a good sleep and all usual workouts, food, some self care. And my interest also, I can spend little time on my hobbies also. Then I start my day with the stand up call with my team, and we kind of follow up with what we had to do on the previous day, and we decide what we want to do today. We establish our agenda and then start working on it. It's a 9-hour shift. Mostly it involves as a project manager, we are a liaison between the company and client, and
Like,
ours is a product based company.
mm,
So we sell hospital information systems, electronic health records, practice management. So I am mainly in this department of hospital information system.
okay.
So and I work along with Indian hospitals. So
Okay.
I am not into US healthcare, although my company is mainly US healthcare company, but we also have couple of products which is
Yeah.
sold in Indian market,
Yeah.
Indian hospitals. So I work along with Indian hospitals. So we kind of plan our day as well as we plan our project. We
Okay.
establish timelines. We give tasks to different teams, maybe the installers, the support team, the technical development, quality, product analyst. So we work along with all these people, and also we communicate everything whatever needs to be communicated, document the data, and we coordinate between client and our internal teams.
Okay.
So this is our I can give this is the overview of how
Yeah.
we
How?
work as a project managers. There will be some days where you have to visit the hospital, you have to do various meetings with the hospital people, and bring them into a common mindset of what we are doing and what they will have to do. Mainly I am handling this operations part, that is implementation of
Yeah.
hospital software.
Okay.
So there will be some days where we have to visit the hospitals as
Hospital.
well,
Yeah. Because on
and
ground
we
applicability of your product, understanding different scenarios, analyzing different tasks through your product, how it is happening and how you can improvise the product, kind of things you might
exactly.
be analyzing, right? Okay.
Yeah, we have to get inputs from the clients also. We have to put our knowledge also into it, and we have to combine together and give out feasible input suggestions to the technical team. And we have to work with other specialized people like pharmacy doctors, nursing, all this group of
Yeah.
people. And we also see, when you are working in a product company, if you know the product well, then you are a winner.
Yeah.
I mean, it is very important that you have the complete knowledge of how this product performs.
Mm.
If not the technical, like you will not be knowing to the code level of it, the technical, most technical field, but you will know how it operates. You
Mm.
will have to know how it operates, because if you know the product well, then you can manage anything,
Okay. So I think,
irrespective of in which
yeah.
team you are, like.
So it reminds me, I mean, if any medical graduate, if he is working in a as a medical officer in particular hospital, and he is interested in this using the hospital software very well, he involve in different tasks, etc. I think if as a medical officer, if he is taking many much interest in using the software well, interacting with that hospital IT team, he might have a potential to be as a project manager in a particular healthcare IT company. Can you say that? Can we say that?
Yes, for sure, that's right. That's what I was telling,
It
like.
might help any person to evaluate his skill. If he is uh,
Exactly.
in his day-to-day work, if he is more into Because I remember when I was
Technical.
working in a hospital, you will find there are very, very few people, one or two people who are very much enthusiast in using the software. He can find
Oh,
data and things, any particular medical or surgical word, you find one guy who
who
understand
is tech savvy? Yeah.
tech savvy. Yeah.
Yes, yes. I have come across such people also who were in the hospital first. After working along with us, then they end up joining our company. So without doing any MHA. See, that's what.
Yes,
If your thought process or your interest aligns with this field, you need not study MHA.
yes,
But for me, although I was interested in this particular field, I actually studied various other things. I mean, health
yeah,
economics or finance, accounts, which
yeah,
is like very totally new for us as
yeah,
doctors, right? We don't get to study accounts otherwise. So everything in all is MHA. So, but it is not mandatory. If
yes.
you're already
But
interested
yes,
in
if he
healthcare
is
IT,
tech
yeah,
savvy and taking interest with his curiosity, then
yeah,
definitely he has a potential of good career in the healthcare IT. You can say.
exactly. Yes.
Okay, okay, fine.
Yeah.
So any, can you give a brief about what is health informatics? So it is
Okay.
part of healthcare IT, but I think there is some different role. Maybe in India, we have not seen that field much, but in US, the healthcare informatics, there are separate master courses are available. If you have any idea,
Yes.
if you can, give some brief.
Yes. So although in US it is a mandatory thing for every other practice management, for every other hospitals to be attached to a EHR, to be
Okay,
attached to a HIS.
okay,
So in whereas in India it is not the situation right now. It is just optional for any hospital, but that is why we have a separate domain as US healthcare.
okay,
So, regarding US healthcare, it runs in quite different way because there is this segregation of primary, secondary, and tertiary healthcare in USA. So, all these different three sectors they adopt EHRs, and they use this EHR as their analytic software. So with just entering the data, they can get all the information or analysis related to the complete healthcare sector in the entire state or in the entire
okay,
country.
okay,
So this then all comes down to this big data analytics and healthcare informatics, through which they derive various learnings or various conclusions. Because
okay.
everybody is using software,
Yeah,
we will not even miss a single data about a patient or
yeah,
about a condition which is existing, and we can guess what will happen next with
okay.
the data we have.
Is that it?
So that is analyzing your healthcare situation using the healthcare IT that you
Yeah.
have.
Okay.
We can say as health informatics, right? It
Okay.
will establish various learnings, various research subjects.
For the
So
research, for the policy making, for the healthcare trends to analyze in a particular
yes,
region, particular demography, and
exactly.
in
It is,
particular.
yeah, establish like knowing what our current situation is, current trend
Yeah.
is in healthcare.
Okay.
So in India also, we can work for US healthcare
Okay.
as a in healthcare IT. Apart from like what I am doing currently is with Indian healthcare, right? But there is this healthcare consulting where business analytics, where you are working for a US healthcare or health informatics in India, remotely or in office.
Hmm.
It is subjective. So you can get into this field also of healthcare informatics, where you are kind of working as a business analytics and business analyst. And then there is healthcare consulting, data analytics, various other based on your specialty. Like if you are a pharmacy, then you are into clinical research and drug database and all
Okay.
the related to drug. And if you are from the very clinical like us doctors, you can get into healthcare consulting, where you will be working for US healthcare and health informatics, like in a broad perspective I'm telling, but that is one of the perspectives, and you get paid very well also. Maybe you will have to work in EST shift, Eastern shifts.
Okay. So,
So that is,
so the last question, and after that we will conclude this session.
yeah.
What suggestions you will give to the medical graduates for their career? Any tips, any advice to basically your suggestions to open their mind and so that they can broader their career opportunities, they can have that thoughts,
Yes. So while studying, of course, we don't have much of light. We don't throw much of
So
light on the other
what
things
exactly
apart from
their
practice.
if they have some thoughts about healthcare IT, what could be the
Yeah.
first step for them?
So basically, they have to think in a product way. I
Okay.
mean, now healthcare IT cannot be a person, right? It has to be, it is an information technology field. So they have to think in a product perspective and how they can add their expertise
Doing
healthcare,
healthcare.
in improving healthcare widely,
Hmm.
and also learn various aspects other than clinical practice if they want to learn more
Yeah.
about healthcare. Being in India, you can also learn about other countries healthcare also
Okay.
by working in, like I said, US healthcare. So you need to think a product or service way. Apart from you treating a patient, there
Okay.
is other
Things
uh,
going on, other
departments also in
surrounding things
healthcare.
going on where you can focus on.
Yes, you have to see a patient as a doctor, means that patient has to come to you.
Okay.
So there are various things involving or making your patient visit you,
Yes.
right? So if you want to know more, if you want to learn more about this entire healthcare sector, and also if you want to learn about technical, I mean how you can improve efficiency, and how you can reduce your error, or make your job easy, how you can avoid writing everything and avoid mistakes or everything.
At
uh,
least they can start
ho-
using different applications also so that we can get some ideas, okay, how
yes,
technology works in
yes,
the healthcare.
exactly.
That also
So
gives
how,
idea.
if you can see broadly, like that is the future, right? So you are not going to be permanently using paper.
Yeah.
Like it is a booming field, or it is going to be a mandate now. ABDM
Yeah.
is one such thing, Ayushman Bharat
Going on
digital mission,
yeah,
where India is also promoting a digital healthcare.
digital healthcare. Yeah.
So if you can have that vision of how the future healthcare is going to be, how as a doctor in future you will be practicing by using a EHR or a product, if you can have that vision, then I think it will be sufficient to enter into this particular career perspective.
So very good insights. I hope that healthcare professionals and specifically graduates will explore this healthcare IT field, and we will be seeing many other doctors will be coming into the healthcare IT, and they will contribute there uh, for the advanced technology
Yeah,
upgradation and also.
yeah, yeah.
So
It
yeah,
is not only hospital software. Actually, there is this field of medical devices,
yes. And
which is again a big,
because
total big
every device is
sector.
now will be connected, will be adopting the AI
Snacks,
applicability,
yes,
and the
yes,
all the devices are nowadays smart devices. So whenever it is
exactly.
smart, that means the IT application has to be uh,
Has to be in place.
there in place in every devices.
Exactly.
So the
So
demand
it's
is very
all,
yeah,
yeah. And when you become super specialized, or when you become a super special doctor, you will always want to use technology in your
yeah,
treatments. So then that means there is some software, there is some healthcare IT thing attached to it.
attached
So
to it.
if you think in that way, it is going to be the future,
Yeah.
healthcare, right? So yeah. So I
So
wish all the best to all the graduates, whoever are very clear to perceive their clinical practice, that is fine. But whoever has this mindset of learning a lot of new things, technical innovation, healthcare innovation, global health, health informatics, they can always think about healthcare IT as their career perspective.
So, yeah, thank you very much, Dr. Madhuri, and it was a wonderful insights about healthcare IT.
Thank
And thank you for connecting with Doctor Talks.